Good morning. I am Rowena Navarro, and I'm an occupational therapist from the Philippines. I worked as a school-based OT for the International School Manila for more than 10 years. I was the first school OT provider, and I witnessed a year-on-year increase in the number of referrals to OT due to handwriting difficulties. And this has been the trigger for this evidence-based project. For this presentation this morning, I will present to you the significance of the problem and my PCAT statement. I will also share with you my search strategy, the evidences, the change model process that I will use, how I will evaluate the outcome, and share the results of this evaluation, my recommendations, and then conclude this presentation. Handwriting remains to be an essential skill of students to express their learning and their thoughts. When their handwriting are illegible, the teachers tend to give them a low mark. It also becomes a problem because teachers feel inadequate to support them in their classroom, so they refer their students to occupational therapy. Now, this situation is true here in the United States as well as it is in the Philippines. At ISM, where I used to work, most of the referrals to OT were handwriting difficulties, and there's just not enough OTs to meet the need. In the fall of 2015, ISM adopted the Handwriting Without Tears program, but the referral for handwriting kept growing. This EBP change project was done in the hopes of improving the students' handwriting skills in the classroom. So my PCAT statement is, among school-aged children in kindergarten through the second grade, what method or methods would best facilitate improvement in handwriting skills other than handwriting without tears in one school year? I used USA Search database, which accesses multiple databases such as PubMed and CINAHL. I got 117 articles using the PICO search mode and used inclusion words, handwriting, school age, visual perceptual training, handwriting without tears, and legible handwriting. Only peer-reviewed articles from academic journals published in English between 2006 and 2020 were included. Exclusion terms were ADHD, dyslexia, and Parkinson's disease. For my secondary search, I used PubMed to determine if there would be non-duplicate studies that would be generated. I got 0 results using the same keywords that I used in USA Search. So I used their advanced search method and used handwriting as the only keywords. Only full-text clinical trials, meta-analysis, systematic review articles published from 2006 to 2020 were included, and the result was 14 additional. I did a third search on OT Search database, again using advanced method. The inclusion terms were handwriting, visual perceptual, fine motor, and visual motor skills. The date of publishing was from 2006 to 2020, and that gave me 31 additional articles. Overall, the search gathered 146 articles after deleting duplicates. Out of the 146, 23 were deemed relevant to the evidence-based project. Out of the 23, only 9 were considered after a final review. The 14 other articles were deleted because a few of them have population samples with autism, ADHD, Parkinson's disease, and other neurological conditions or genetic and chromosomal anomaly. Also, some articles spanned 2 years of study. The others did not involve handwriting without tears and had home programs in it. One systematic review article was eliminated because it was a poster presentation only. The other one was an appraisal paper of one of the articles that's already included in the search. There are 3 main approaches from the reviewed studies: intensive handwriting practice, sensory motor-based intervention, and cognitive approach. An additional factor that was investigated in the studies was the frequency and duration of intervention. One systematic review and 3 paired group clinical trials concluded that high levels of handwriting practice is essential to improve handwriting skills. Therapeutic handwriting practice refers to using worksheets appropriate to grade level, writing activities related to school curriculum, and some fun writing activities too. Another systematic review says that the studies showed that all handwriting curriculums for practice are all equal. However, some are more useful for improving legibility, and some are better for facilitating faster handwriting. Right Start program and a couple of specific handwriting programs in the review were efficient in improving handwriting speed, while the Size Matters handwriting program targets handwriting legibility. Sensory motor-based intervention had mixed results. Only 2 clinical trials showed improvement in handwriting using sensory motor approach. One of those was done in China, and the subjects wrote in logographic font of Chinese, and its findings cannot be applied to the US alphabet font, and that also cannot be applied in the setting of my EBP change. This is in contrast to the findings of a systematic study saying that participants who had a sensory motor-based intervention did not have significant improvement in handwriting skill. According to Weintraub and others, children gained immediate and long-term improvement in penmanship using cognitive approaches like mnemonics and self-evaluation combined with sensory motor and task-oriented activities. They did not, however, impact handwriting speed. Second graders compared to first graders had significant improvement in handwriting legibility using self-evaluation based on a systematic review. It also says that providing specific instructions to write letters and self-evaluation results in improved handwriting legibility, but not in faster handwriting. Regarding intensity and duration of intervention, the average length of session that resulted in improved handwriting in neurotypical children is 30 minutes at a rate of 2 times per week for at least 10 weeks. The Cotter's 8-step change process will be adopted in this project. It starts by building an urgency to act on the problem, building a guiding coalition, creating the vision and strategy of change, communicating the vision to others and empowering them, and then celebrating small wins through frequent and constant feedback, consolidating more gains, and then anchoring the change. This appears to be more consistent with the culture of ISM, and it also matches my own thinking process. Following the steps of Cotter, the problem, the vision, and strategy of the proposed change will be presented to the administrators. And then, this current OT shortage situation that I mentioned earlier is already known to them, and buy-in is expected due to this awareness and the minimal cost that the school will incur. Now, gaining their support will be instrumental in buying in the teachers of kindergarten, first and second grade classes, and the parents as well. This will be done when the vision and changes are communicated to them in a faculty meeting and a parent meeting respectively. To empower the teachers, they will be given training, and an OT will co-teach for at least 10 weeks. The parents, on the other hand, will be invited to observe and will be given clear and concise instructions for the students' homework. To generate the small gains, the OT working with the teachers will give verbal feedbacks regularly on the observed improvements of the students as a result of the change in teaching handwriting. The result of the change evaluation will serve as a consolidated gains, and its dissemination will be discussed later. The administrators will be key to anchor this change to continue to endorse and enforce the new method of teaching. How will I measure the outcome? The test of handwriting skills revised is a chosen evaluation tool to measure handwriting legibility. It is a standardized norm reference test for children 6 years and older. Although this test is time-consuming, it has an established reliability and validity scores. Since the THSR has no norm for 5-year-olds, the norm for 6-year-olds will be used, and this step is patterned after the study done by Ekberg, Zylstra, and Pfeiffer. The students will be given a pre-test before starting the program and then a post-test after 8 months of the EBP change. The handwriting legibility scores are interval variables. To determine the minimum number of subjects that would make significant change in the data, a power analysis with a 0.05 alpha will be computed. The pre- and post-test scores will be compared using paired t-test, and then an effect change score will also be done to make sure that the change in pre-test and post-test scores are indeed significant. To whom will I share the outcome? Firstly, to the International School Manila administrators, because they are the main and decision-making stakeholders of this EBP change. And then I will roll out the result at the weekly faculty meeting. And then an article on the outcome of the EBP change will be posted in the school's newsletter for the parents. The content of the article would be worded differently and will only focus on the specific gains of the children and how continuing the change will be of benefit to them. In the national level, I plan to present the project to the National Convention of Philippine Academy of Occupational Therapy, which is the national OT association in the Philippines. In the Asian region, I'd like to share to the Special Education Network and Inclusion Association and be published in the International Schools Journal in order to share this information to all the international schools globally. It would also be relevant to share this to the Asian Journal of Occupational Therapy, and because I now live in Texas, I would want to share this with my fellow OTs in Texas using their Revista OT online publication. From this study, these are my recommendations. For handwriting intervention, I recommend to continue to use handwriting without tears with the intensive handwriting practice at 30 minutes each session, at least 2 times per week, with emphasis on step-by-step instructions for writing each letters and numbers. The students will also be taught to evaluate their own writing in each session. Homework is also highly recommended with the same focus on step-by-step instruction and self-evaluation facilitated by parent or the caregiver at home. It's also recommended to establish an after-school handwriting group to further support those with difficulty in handwriting. Another recommendation is to do a validity and reliability study of the available handwriting evaluation tool for kindergarten students, like Sure Handwriting Screening Tool and the Print Tool. Both tests have preliminary studies on validity and reliability, but nothing has been established. In summary, handwriting is still an essential skill for students. Among elementary students, kindergarten through 2nd grade, what method or methods is best to facilitate handwriting skill other than handwriting without tears in one school year? 9 articles say that intensive handwriting practice and cognitive approach delivers the best result with at least 30 minutes 2 times per week of writing intervention. The Cotter's 8-step change process will be adopted and the outcome will be measured using the test of handwriting skills revised, and the scores will be compared using paired t-tests. The result will be shared to administrators, teachers, and parents. It will be presented nationally to the Philippine Academy of Occupational Therapy, and then international level to SENIA, and get published in the National School Journal, Asian OT Journal, and Revista OT. I recommend to continue using HWT with longer practice times and emphasizing the step-by-step procedure in writing each letter and number and teaching the kids to check their own work. A handwriting group after school is highly recommended utilizing the same approach. A validity and reliability study for Sure Handwriting Screening Tool and Print Tool is recommended. Thank you so much for your time. These are my references that I used. And if you have any questions, I do welcome them. I would love to answer them. Again, thank you so much for your time.